Kelly joined the Giffords Law Center in 2017 and serves as the organization's research director. In her role, Kelly serves as an expert on the nature, dynamics, and epidemiology of gun violence in the United States. Her work helps to inform the organization's policy agenda with evidence-based research and practices. Kelly also oversees and authors research reports, including those which involve original data collection and analysis to bolster efforts to advance national, state, and local firearm policy reform. She has authored reports focusing on the use and implementation of extreme risk laws, trends in gun violence research publications, and the impact of school shootings and gun violence on American children. She received her MHS from the Johns Hopkins Bloomberg School of Public Health, where her master's thesis focused on media coverage of gun violence, and her BA from Rhodes College. We would like to welcome Kelly Drane from the Giffords Law Center this morning.
Well, thank you, Debbie, and thank you all for having me. I'm going to share my screen, hopefully successfully. Yeah, well, I'm really excited and I'm grateful for you all for having me to have this important conversation. I think this is a really important issue, and I'm excited to talk about it with you all. I just wanted to start, for people that aren't familiar with our organization, I wanted to share a little bit about the organization and the work that Giffords does. Giffords is led by former Congresswoman Gabby Giffords. She was shot in the head while meeting with her constituents in Tucson, Arizona, along with 18 others in 2011. You can see a picture of Gabby here. This is a picture of Gabby during her recovery process. About 2 years after she was shot and following the tragedy at Sandy Hook, she founded the gun safety organization now known as Giffords, recognizing more needed to be done to address gun violence in America. And the work that we do involves working with advocates, lawmakers, and citizens at the federal, state, and local levels to research, pass, implement, and defend gun safety laws and programs that protect our communities. On the screen right now is a chart showing the number of gun deaths by year for the last decade. This is the last decade for which we have available data. In 2021, there were 48,830 gun deaths in the US, which is the highest number on record going back to the late 1960s. And part of why we saw this high number in 2021 was that we had seen really massive increases in violence in recent years. In particular, since the pandemic started, we saw sharp increases in gun violence from 2019 to 2020. The gun death rate across the country rose 15%, and it rose another 8% from 2020 to 2021. For many of us, I think when we hear about gun violence on the news, it's often in the context of mass shootings, and that might be the first thing that we think of when we're thinking about gun violence. And mass shootings are certainly a significant public safety threat. These incidents are incredibly devastating and heartbreaking, and the organization that I work for was born out of these tragedies. We also know that they are a growing issue. So last year, we saw that there was more than one mass shooting each day in this country. But mass shootings are actually a very small fraction of the gun violence epidemic in the US. They make up just about 1% of gun deaths in the United States and really are just the tip of the iceberg when we think about this issue. So this chart is a pie chart of gun deaths by intent in the United States. As you can see, the majority of gun deaths in this country, about 58%, are gun suicides. About 39% are gun homicides. That would include mass shootings, but also includes gun homicides of other intents. We also know that about 1,100 people each year are shot and killed by police. About 1% of gun deaths are unintentional, and that can be things like hunting accidents or children accessing firearms and hurting themselves or others unintentionally. And then the remaining number of deaths are those where medical examiners are unable to determine the intent of death. This screen shows the percent of suicide attempts that end in death. I'll talk a little bit more about the graphic in a second. So maybe not this audience, I don't know what your expertise is coming to this issue, but sometimes people, when I present this information or the graphic on the last slide, people sort of question why I'm including firearm suicide in the conversation about gun violence. And I would point out that not only are the majority of gun deaths gun suicides, but we also know, in fact, that more than half of all suicides in this country are gun suicides. Guns, in fact, play a really important role in fueling our nation's suicide crisis. So this chart shows the percent of suicide attempts which end in death. And if you look here, there's a bar with drug poisoning or medication poisoning. If someone attempts suicide with a drug or a medication, those attempts end in death about 3% of the time. But when people use a firearm, we know that those attempts are fatal 90 to 95% of the time. So research says that simply disrupting a suicidal person's access to firearms can dramatically lower the likelihood that they will die. In fact, even if we do none of the other things that we know we should do to reduce suicide risk, like providing counseling and mental health services, simply removing access to firearms will reduce the chance that a person will die by suicide. And so again, I would just argue that if we take guns out of the conversation about suicide or suicide out of the conversation about guns, we're really doing ourselves a disservice. I also really quickly wanted to mention there are a variety of different ways that gun homicides manifest in this country. We know that the majority of gun homicides in the US are connected to community violence. That involves a very specific pattern of gun violence that happens in our cities and large towns, and it disproportionately impacts Black and Brown people, particularly Black and Brown men. And in fact, we know that more than half of all gun homicides in the US take place in just 127 cities, even though these cities comprise less than a quarter of the total US population. We also see gun homicides connected to domestic violence. More than 800 women, for example, are shot and killed each year by intimate partners. And then the rest of gun homicides are made up of a combination of incidents related to mass shootings, hate crimes, and other kinds of circumstances of homicide. I also just wanted to point out, in this chart on the screen shows homicide by means. It shows that firearms make up the vast majority of firearm homicides make up the vast majority of homicides in this country. About 80% of homicides in the US involve firearms, far more than knives, suffocation, personal weapons, which is like your own hands and feet, poisoning, and then other means. I think another really sobering aspect of gun violence in America is that gun violence is within the top 20 leading causes of death for every age group, but it is the leading cause of death for children. So in the last 2 years, more children have died from gun violence than from accidents or car accidents, than from COVID or from cancer. In fact, we know that in 2021, 1 in every 14 children under the age of 18 that died in the United States died from gun violence. This chart shows gun death rates in the United States and other high-income countries like Switzerland, France, and Canada. The United States obviously has a much higher rate. The other countries have rates, in many cases, below 2 deaths per 100,000. So I think it's really important to remember that the statistics that I've just talked about really set the US apart. We are an extreme outlier compared to our peer nations and actually to many other nations as well. Americans are 11 times more likely to die from gun violence than people in other high-income countries like France, Australia, and the United Kingdom. And in fact, we are 25 times more likely to be killed in a gun homicide than people in other peer nations. I think it's really important to understand that within the US, there are significant disparities in exposure to gun violence and gun violence risk. And your experience with gun violence is impacted by who you are. So things like your gender, your race, your income, and where you live. As one example, we know that when it comes to gun suicides, 80 to 85% of deaths involve white people. And in fact, white people are 2.3 times more likely to die by gun suicide than Black Americans. But when we look at gun homicides, we see almost the opposite pattern. Black Americans make up 80 to 85% of gun homicide deaths, and die by gun homicide at 12 times the rate of white Americans. And I do want to point out this disparity in Black and white homicides, or gun homicides, is so significant that actually Black people overall die from gun violence at 2.5 times the rate of white people. So even though more deaths overall are suicides, this extreme concentration of homicides in Black America makes them more likely to die by gun violence overall. We also see differences when it comes to geography. So this is a map of the US states, and they're color coded based on states that have the highest rates of gun violence. They're like a bright red, and then states that have the lowest rates of gun violence are like a dark blue. The states with the highest rates are states like Mississippi, Louisiana, and Oklahoma. The states with lower rates of gun violence are California, New York, Massachusetts, Hawaii. So people are 8 times more likely to die from gun violence in the state with the highest gun death rate compared to the state with the lowest gun death rate. I would note that even within states, there's a lot of variation. So Mississippi is actually the state with the highest gun death rate, but there are neighborhoods and communities and even entire counties in Mississippi for which gun violence is extremely rare. And then there are pockets in really safe states like Massachusetts where gun death rates are, where gun violence clusters and gun death rates are quite high. I want to step back for a second because most of the data that I've shared has been on gun deaths, largely because that's where we have the best and most reliable data. But I think it's important to acknowledge that the impacts of gun violence go beyond just gun deaths. And I really want to emphasize that even while gun violence takes a disparate toll on some people, or takes more of a toll on some people than others, it also takes a toll on all of us as a society. In fact, we collectively bear the burden of this epidemic. So there's a box here that shows that there's an average of about 43,000 gun deaths each year. That's based on data from the last 5 years. But we also know that for every person shot and killed, 2 more are shot and survive. These injuries can be really debilitating and life-altering. They can cause significant pain and challenge for those that are impacted. We also know that even when a firearm is never fired, they can cause harm. So a recent study found that 1 in 10 US adults has been threatened with a firearm by an intimate partner. And firearms are also used in non-domestic violence contexts to threaten and coerce. So we know that millions of Americans each year are experiencing this kind of exposure. We also know that millions of people witness gun violence. The best data on this really comes from children. We've done better surveys of children's experience witnessing gun violence. Those studies show that about 8% of kids witness a shooting each year. I would also note that that data predates some of the recent increases in violence, so it's probably higher now than it was a few years ago when those studies were done. And we also expect that adults witness violence and witness gun violence at even higher rates than children. So likely millions of Americans each year are witnessing shootings. We also knew there was a recent poll that found that 58% of Americans say they or someone they love has been a victim of gun violence. That would be about 120 million people. And finally, researchers have estimated that given the patterns of gun violence in the US and the distributions of our social networks, that nearly all of us, I think the number is 99.85% of us, will know a victim of gun violence within our social network. So in other words, perhaps not a direct connection, but maybe we'll have a friend of a friend who has experienced gun violence. And I think it's really important to note that these exposures come with costs. They aren't just the cost of lives lost, but there are a number of ways in which gun violence directly impacts our society. Even if we aren't sort of directly connected to acts of gun violence, we experience these impacts. One of the ways this manifests is the toll on our mental health. So research shows that people who are shot or present at the time of a shooting are more likely to experience trauma and mental health impacts, like elevated levels of psychological distress, depression, and suicidal ideation. But even people who don't directly witness a shooting can be impacted. In one study, researchers found that children who lived within a few blocks of a shooting were nearly 50% more likely to seek medical care or mental health care, I should say, at an emergency department in the days preceding the incident. And so these were children that weren't necessarily witnesses to the shooting. They weren't necessarily even home at the time of the shooting, but they still saw elevated rates of mental health concerns. And gun violence also has an enormous financial cost. And again, this is one that we all share. Economists estimate that gun violence costs $557 billion annually. That's equal to about $1,700 per American. Many of these costs are directly borne by us, the taxpayers. A single gun homicide or assault, for example, is going to be accompanied by costs related to the police investigation of the shooting, the costs to incarcerate the offender, and the mental and medical care, healthcare costs for victims. So we know, for example, that the majority of gunshot victims are on public insurance or will go on public insurance as a result of their injury. So taxpayers are footing a lot of this medical care cost for gun violence victims. I also think it's important to note that as big as $557 billion is, I think it's like more than 2.5% of our nation's GDP. It actually fails to account for a number of other ways that gun violence takes a financial toll on us. As one example, we know that businesses and schools have had to take steps to address the threat that gun violence poses. So a lot of us have seen these things, right? There are things like hiring security personnel and installing cameras, making safety plans, and all of those things are very expensive. One study, for example, found that hospitals and healthcare systems spend about $2.7 billion, or spent about $2.7 billion in a single year on proactive and reactive responses to violence in their facilities. Some of these costs included the unreimbursed medical care for victims of violence, but the plurality of these costs were actually related to security and training costs to prevent violence within hospitals. And again, I would just emphasize that many of these hidden costs are things that we will all pay for eventually one way or another. So, you know, we talk about if a business has to implement more security and hire security guards, that may actually raise the price of goods that they're selling to compensate for these additional security costs. I wanted to end on a slightly more optimistic note, or at least leave you all with the thought that this is not an intractable problem and that we do have some solutions. I could give a whole presentation on the impacts of gun policy, but as we sort of set out at the beginning, that's not really what we're doing here today. But I did want to show you one thing. This is the gun law scorecard that we create at Giffords. Every year we score states based on the strength of their gun laws. So we give states points for passing laws that research shows will reduce violence. We take points away when they pass dangerous policies, and then we assign states an overall grade. And we've been doing this project for more than a decade now, and we see the same thing every year, that states that have stronger gun laws have lower rates of gun deaths. If you look at this image, you'll see that most of the A states, these are the bars represent their gun death rate. Most of the A states have gun death rates well below this national average line. Almost all of the F states have gun death rates well above the national average. And so I just want to leave you with this thought that as you consider some of this data and the information about the impact of gun violence, that those statistics are a direct consequence of our leaders' intentional choice not to act on this issue. But we don't have to live this way. You can see it from the chart that I shared on gun deaths in other countries, and also from this one that you know, there are differences in rates of gun violence, and policy and practices can reduce the burden of gun violence on our states and our nation. So yeah, I just want to leave you with that knowledge that this is an issue that we can tackle, and we just need to have the political will to do it.
Thank you, Kelly. That was very informative. Thank you very much. And moving on with the program, we next have Dr. John Leskovan. He graduated from Riverside High School in Paynesville, Ohio, and then made his way to Mount Union University, where he played football and wrestled. At the same time, he double majored in biology and chemistry, so he was pretty busy in undergraduate. He then went on to Ohio University, where he completed his medical degree in 2006. He started in residency at Mercy Health St. Vincent Medical Center in surgery and finished his fellowship in surgical critical care at the Ohio State University Wexner Medical Center in Columbus. Subsequently, in 2017, he started Glass City Specialists and became the trauma medical director. In 2018, with the help of some key people, he wrote a grant to start the Trauma Recovery Center. Currently, he's also the chief of staff elect for all 4 Mercy Health campuses in Toledo. And I understand that, am I correct, that the Trauma Recovery Center is relatively unique, that there are not that many of them around?
Yeah, that's true. There are 7 in the state of Ohio, which typically is a little bit more than most. There is a national alliance of trauma recovery centers. It was actually started out in California, but it's a really awesome thing that got started here. We wrote a grant, and actually we'll talk about it in my presentation. So if I'll share my screen.
All right.
And so, thank you for the opportunity to come and speak. And quite honestly, you might hear some of the same statistics that Kelly presented, and really just illustrates what a real issue that we have to deal with. My perspective is a little different. As a trauma surgeon, it's maybe a little bit more, kind of personal. And so what I thought I might do is give you a little introduction as to how my world goes, right?
Mm-hmm.
So I am at the hospital. I'm a trauma surgeon, and I we used to have pagers, but now it's on our cell phones, and we get a page, and it comes across this: pediatric male, ED, trauma alert, gunshot wound, chest, room A, here now. And we all run down to the trauma bay, and the EMS brings the patient in, and we get a report that says, this is a 16-year-old male at a party who was down for 7 minutes. We got him we got him here as fast as we could, doc. We lost pulses in the ED parking lot. We start the massive transfusion protocol. All of our medical training says that we should do a thoracotomy, which is opening up his chest. We do full resuscitative efforts, and we work on him for 43 minutes. And after about 20 units of blood, we don't get him back. And then time of death is called at 2:33 in the morning. And somebody says to me, Dr. Leskovan, are you going to go talk to the family? And, this is happening more and more and more. And I think it's important to understand that, whether this is a mass casualty incident or a multiple casualty incident, the crisis in the United States is real. The crisis is real in, Toledo, Ohio, as it is in Los Angeles. And lots of people will ask the questions or say, why did this happen? I'll never be the same. My whole life is ruined. This is all my fault. And quite honestly, the answers are so complex and multifactorial. It's really hard to study. We'll take a look at, get my next slide going here. We'll take a look at some of the, gun violence and the data. I think we have to get a sense of what we really mean when we start talking about gun violence. As Kelly had mentioned, that suicide is also part of gun violence, and it is equally a challenging problem. So as homicide, the mass casualty shootings typically will be a number of people who were injured at the scene of about 10 or greater. The smaller acts of violence, the multiple casualty incidents, are about 5 to 10, and then you have those individuals that are homicides, and it's 1 to 3 patients that we deal with. These forms of gun violence are crucial to differentiate. There's distinct motives in each one of them, and the risk factors and the scope and impact of the individuals and communities are different. And each one sort of require its own dedicated research. So I thought what we would do is take a look at some of the data nationally, maybe at the state level here, at locally, it's what's happening in Toledo, Ohio. And then we'll examine some of the economic burden on the system. And we'll talk a little bit about value of statistical life and what that means. So what's happening around the country with gun violence? As Kelly clearly pointed out, that the United States has the highest rate amongst developed countries, as high as 20 times higher. The 13.7% death rate is the highest actually since 1974. That peaked at 16.3 per 100,000 gun deaths. My data is in 2020, we had 45,222 deaths with a population of 329.4 million. And that gives us that death rate of 13.7 per 100,000. About 124 people die daily to gun violence. That's more than people who die in a motor vehicle collision. In fact, if you take a look at, and since 1968, more people have died from gun violence than all of the wars in which the United States has participated in, beginning with the Revolutionary War. Okay. And you might ask, is this going up or down, or, you know, what's the increase? In 2020, there was a 34% increase from last year, from the previous year, and 75% increase since 2013. And as Kelly, mentioned earlier, there was a study in 2016 that suggested that there was a 99.9% chance that people in your social network contained a victim of gun violence. 99.9. And so, that was 2016, 2023, with all of the Insta, Twitter, YouTubes and all of the social media, it's almost a guarantee that somebody knows a victim of gun violence or was affected by gun violence. And, as Kelly pointed out, the economic burden is just tremendous at billions of dollars with a B. So if we take a look over in Ohio, what's happening in the last 15 years, you can see that the number of firearm deaths jumped from 1,116 to 1,764 in 2020. And that actually put us 23rd for firearm death rates in the United States and 5th for the total number of deaths. It's a problem nationally. It's a problem at the state level. And so, when we start talking about the leading cause of death, and Kelly pointed this out earlier as well, but we can't drive home the point enough that this is a significant issue. But when you start looking at the leading causes of death in Ohio, firearm homicide is the number one cause of injury-related death for ages of 15 to 19. It's the number 2 cause for ages 10 to 14 and 20 to 34. And it's the number 3 cause for ages 1 to 4 and 35 to 44. That means that a patient or a person who is the age of 1 to 44, it's the either number 1, 2, or 3 cause of death. That is tremendous. So when we start looking at, the injuries and associated costs, the medical costs, we often will talk about this value of statistical life. And really, what does that mean? If we have 100 in 2020, there was 824 deaths that were related to homicide. The medical costs of that were $8.63 million. And the value of statistical life was $9.7 billion. What does that mean? So that is the benefit of preventing a fatality that's measured. It's the additional costs that individuals would be willing to bear for improvements in safety that reduce the expected number of fatalities by 1. So there's a lot of kind of misconception, and the conventional terminology makes you kind of get confused a little bit. Make no mistake, this is not the valuation of life, but the valuation of reductions in risk. So basically, what does it take to prevent that 1 death? Let me give you an example. So if there's a 1 in 10,000 chance annually of dying in an automobile crash, if you have an individual willing to pay $1,000 to reduce that annual death by one, that 1 in 10,000, the injury, and that is to say that the statistical value of statistical life is $10 million. It would take $10 million to reduce that risk of death by one. And so when we start looking at homicides and the value of statistical life, it's $9.7 billion to reduce those risks to zero. Suicide is the similar. It's 903 deaths. So in 2020, there were 1,727 deaths alone, with a medical cost of over $11 million and a value of statistical life of $17.5 billion to reduce that risk of death. It's tremendously impactful. The amount of cost it would take to try to reduce these risks is enormous. And I think we really need to focus in on how we can, start working towards that. So what happens here in Toledo? Interestingly, the increase in gun violence happened from 2019 to 2020. But in 2019, there were 38 homicides, and 28 were by gunshots. And you can see in 2020, that there were 61 homicides and 53 by gunshots. That trend you can see in 2020, 2021, and 2022 is very similar, and it went up in 2019 and stayed there. It's an enormous problem. I think what we're seeing at St. Lee's, where I work, is in level 1 trauma center, and we're experiencing the same data. So we track all of our injuries. Our penetrating trauma rate went from 7% to 13% in that same time frame, nearly double. There are some things that are happening in Toledo. So the Toledo Police Department has implemented a program called Spot Shotter that uses some proprietary software. It kind of analyzes noises that happen. There are microphones placed throughout the city, and that analyzes sounds of bangs and triggers an alert. Even before somebody calls 911. I think, since implementing that around April of 2021, there's been about 115 guns taken off the streets and 151 arrests. It also, from a medical standpoint, it gets patients to us earlier, and perhaps we can do a little bit more to save their lives. You might ask, well, what was the impact of COVID on gun violence? And so there was a study in 2022 that analyzed firearm violence during the COVID pandemic. It took 4 areas: Baltimore, Chicago, Los Angeles, New York, kind of set a baseline of data, and then ran the same kind of characteristics through March 1st through February 28th. And there were a total of 62,485 incidents. And they were able to separate out and attribute that 8,000 of those were excess incidents. There were 10,000 non-fatal incidents, and about 4,380 increased fatalities related to COVID. This led to an overall relative increase of about 15%, and the highest areas were seen in Kentucky, New York. Michigan was the third. I only mentioned Michigan as it is our catchment area. And with a 49.9% increase, and Ohio was an 8th on the list for increase of 42.3% of related firearm deaths in Ohio. The impact on health and well-being and work, school closures, other social distancing measures, those are kind of being studied now, and the impact of gun violence. But some of the emerging evidence is starting to suggest that there was a substantial impact on mental health, leading to some of the gun violence. And if you think about what happened with COVID, what's happening with the gun violence, it really, this was like a hurricane for gun violence risk factors. There was worsening economics, psychological strain, job loss, increased rates, intimate partner violence, and child maltreatment went up. And all the while, gun sales went up too. This was kind of the perfect storm for this. And so that's kind of the impact of COVID on gun violence. As Kelly mentioned, there's quite a disparity of the effect of gun violence and community and culture. And And one of the more realities of COVID, was that alongside some of that systemic racism, there were health disparities that the pandemic brought. So if you remember that persons of color were at greater risk for diagnosis with COVID, hospitalized with COVID, die from COVID. And it's not new information. I mean, you just heard Kelly talk about it, but the gun violence was mostly felt by the Black communities, and particularly Black men, as Kelly pointed out. And some statistics would suggest that they're 10 times more likely, at least, to die from gun violence than white men. And so, both COVID and the systemic racism and things that we're facing, this was, again, created a perfect storm for gun violence. I think, there's whether it's suicide or homicide, everybody, they each have their own challenging risk factors. And I think we really need to start exposing what some of those risk factors are and identifying those so that we can hit the base and the root of the problem. Does gun violence affect the mental health of U.S. children? I think the answer clearly is it depends. Kelly's favorite thing as a lawyer, it depends. And so, rarely is there kind of that simple cause and effect relationship that applies to the same degree to all kids. There is some essential truth to that ecological perspective, where you came from, what your neighborhood looks like, this sort of demographics. But gun violence does highlight two issues facing United States society: that traumatic response in children directly exposed. You can take a look at two aspects of it: those that were directly impacted, and then that sort of Kelly was talking about, you don't even have to be involved, but there is a contamination of the consciousness of young people, particularly those with mental health issues, already in an environment in their social media. They don't have to be involved in the gun violence, particularly itself. And so they're starting to look at some of that, those areas. This also kind of, poses a second question of how do children and adolescents develop in the wake of trauma? The good news is about 80 to 95% of these cases with resolve within about a year. The other 15% tend to be those whose lives were already disrupted, kind of this multiple incident chronic trauma. And the challenge with these kids is that there's often a failure to receive kind of a real substantial mental health support. There's things like trauma-informed care, psychotherapy, that old adage of it's okay, you're okay. That doesn't work. Things will be back to normal. That they don't work. There have been studies. And so this chronic trauma and multiple incident kind of produces poor self-esteem, interpersonal distrust, feeling of shame, dependency. And so gun violence really does expose a lot of areas that need a little bit of more exposure and help. A lot of times people are exposed to that repeated trauma. That's their normal. So when we put them back into that environment and their normal, it creates this vicious circle. Teenagers in particularly are vulnerable to the audience effect. That means sort of the teenager and adolescents tend to see themselves as they're in a play, and their peers are their audience. And this is excruciatingly obvious today with social media. And that is a big player in some of these mass casualty incidents where people are posting prior to shootings or suicides. It's an area that needs to be explored for sure. We might think that mental health and gun violence is a significant issue in terms of those patients who have mental health disorders are more violent. It's actually quite the opposite. People with schizophrenia are not more violent than other Americans, but they're often stereotyped to be violent. In fact, they're more likely to be victims. And there was a study that looked at auditory hallucinations in the United States, Ghana, and India. And what it looked at was the voices that people were hearing. 70% of the voices heard by U.S. citizens told them to hurt themselves or others. 20% in India, and 10% in Ghana. Even when people are sort of somewhat disconnected with reality, the American culture of violence has snuck in. It's impressive. So what are the common reactions to trauma? You often get this sense of losing hope. You're feeling detached and distant. You're unable to concentrate. You're unable to make some of these decisions, and people often will lead to coping mechanisms that, quite honestly, aren't healthy: eating more, smoking, alcohol, and drug use. When we start looking at what people are getting diagnosed with, it's acute stress disorders. That is an intense, unpleasant reaction shortly after some traumatic event, and that really should last less than a month. Who's at higher risk for that? If you have some version of PTSD in the past, or there's prior history of chronic trauma, you're at higher risk. Then there's the PTSD. This is a thing that typically lasts a little bit longer, and it may develop relatively shortly after the event, but it doesn't have to. There are 4 different types: that re-experiencing, avoidance, negativism, and hyperarousal. That re-experiencing is what people most commonly are familiar with. They have that flashback. This is the fireworks that trigger the shooting again. And so what are we doing to combat this locally? In 2018, my team and I wrote and submitted a grant to the Attorney General's office under the Victims of Crime Act. What we started out doing was providing mental health treatments that included trauma-informed care, that psychological first aid, psychotherapy to victims of violent crime. And it also not included just the victims, those that survived, but it was also to the immediate family members. This was provided at no cost through the grant. We have 4 members on staff currently that treat children 8 years old and above. Below that is a very specialized realm of psychotherapy. But it was initially started out at $758,000, but there are a lot of government grants that are getting cut very fast. COVID ate up a lot of the budgets, and the need is so great that we're burning through our money quickly, providing all these cares. So, kind of to combat that, there is tons of data suggesting that patients coming out of the ICU have post-ICU syndrome. There's programs through the Society of Critical Medicine called Thrive. And so what we've been able to do is turn our recovery center into an inpatient screening modality to help screen the patients prior to leaving the hospital, and then also following up with them as outpatients. And it's become quite a project. But again, without funding and without continued success. I will shamelessly plug that you can donate to the TRC. There's an endowment that my wife and I started, and you can donate through the Mercy Health Foundation. Where do we go? I think that we need to take on the challenges. One of the things that studying these things is hard because, as Kelly pointed out earlier, most people aren't involved in gun violence. And so when you start trying to get research done and start looking at this huge problem, it's very hard to study. I think we need to try to unwind how victimization experiences confer risk for the hot topics of gun ownership, gun storage, carrying, use of behaviors, roles of mental illness, and some studying the environments of repetitive trauma. I think we need to keep in mind the experiences of racism and discrimination and that internalized racism, and how these factors shape some of the perceptions around do you need to carry a gun? How do you carry a gun? Weapon use, and then I think if we look at examining some gun behaviors, firearm attitudes, gun perception, emotional risk, it's not going to be easy for sure.
Thank you very much, Dr. Leskovan. And we really appreciate the input that you gave us and the information that you gave us in your experience with that. In my life, I've known 4 people that were murdered, 3 by guns. One was a hired hit, and the other 2, husband and wife who had just come home from vacation, and the person that they had that was watching their house for them shot them to death when they entered the house. And that was probably the hardest one to deal with. But, you know, so maybe I'm not going to be involved in gun violence myself, but it does touch me. And as I said before we started, as a teacher, it was difficult to deal with the incidents of school shootings, you know, and work with the students with that. And that it was downright scary sometimes to go to school because of that. So thank you very much for the work you're doing. Okay, we are going to open this up for questions for Dr. Leskovan and Kelly. You can either raise your hand by using down in the bottom taskbar, you can see reactions, and one of the reactions is to raise your hand, or you can put some questions into the chat. And one of the questions that came into the chat early on was about the use of blood products. Have American Red Cross collects and distributes more than half the blood and blood products in the country, and 90% in Ohio. Have they ever made any comments about the cost of blood and blood products in relation to gun violence?
Yeah, Kelly, I'll take that one. Just kidding. The American Red Cross does provide us units of blood and supplies our blood at St. Vincent's. It's never really a question of who's getting that and why we're giving it. It's those patients need it, and we treat patients. And as a trauma surgeon, and quite honestly, I'm the chair of the blood utilization committee as well. So we do take into account of cost, but it has really never really been directly looked at here in Toledo locally to separate out how much was related to gun violence. And it's really just when we call and ask, we need it, we sort of get it.
I don't know if you have other things. Well, I will say there was a study, and I'm not a clinician, but there was a study that found that compared to other sorts of traumatic injuries, victims of gun violence were more likely to, they were, I think, 5 times more likely to need a blood transfusion, and they were also more likely to need a higher volume. So I don't know how that affects the cost, and I don't have numbers on that, but I do think, in terms of blood utilization, the research that I'm familiar with suggests that gunshot wound victims do need more blood than other, people that are experience other kinds of traumatic injuries.
Okay, thank you. We have a hand up from Dina Magulius, who is a physician. So maybe she's got some perspective. Go ahead, Dina.
It seems like there's trying to stop gun sales would be a way to prevent the suicides and the domestic violence killings, because one of my friend's sons killed himself, and also I've known patients who were killed by their spouses. But the majority, I work in the inner city and I've worked there for many years, and the majority of my patients who are young Black men who have gotten killed, a lot of it has to do with gang violence and selling drugs. So the only thing I can think of to prevent this is to get kids when they're young involved in job training and really work with them from a young age so they won't join gangs and feel like they have to sell drugs. The other day, one of my patients came in and he told me his nephew was killed. And I said, well, why? What happened? And he said, well, you're making a lot of money. So these people making good money. And they say, well, I can go out and get an $10 an hour job and be in poverty the rest of my life, or I can go sell drugs. And I know that if I go sell drugs, I might die at a young age. I might get shot and killed, but I'm going to take the risk. So they take the risk and they get killed. Every day in Cleveland, I open up the newspaper and there's somebody getting shot. They're finding dead bodies in cars and murders everywhere. Every single day, somebody's shot. I live near the Buckeye neighborhood in Cleveland, which is a really poor neighborhood, and in our neighborhood, there's a lot of killings. And I think to myself, well, this happened with the mafia too. I mean, in the olden days, you had the Irish and Italian mafias, and they were selling bootleg and alcohol and everything else, and they were shooting each other because of territory issues. And that's what's happening here. You know, you're in my territory, you're trying to steal and so they're shooting each other. So the only thing I can think of really is to start young with these kids and try to work with them. And I don't really see that happening too much. You know, job training, you know, community, more involvement. And so I'd like, if somebody could comment on that, you know.
Yeah, I think that's a pretty complex scenario. You know, I think it's so multifactorial. I think, you know, if you start looking at demographic stuff and father figures, roles, the area that you live, I mean, it can't just be one, you can't attack one side of it. It has to be all of the aspects of the risk factors for gun violence, both homicides and suicides. And, you know, even the social media aspect of it. And Kelly, maybe you comment too on some of your exposure or research to attacking it at multiple levels. I think if you start looking at, you know, I was kind of alluding to that on in my presentation, but some of that social, systemic, you know, there's interesting data about redlining and pushing putting people into environments, and then that creates a whole dynamic. And I think it's so multifactorial. I don't know if you could just pick one spot to say, okay, well, that's going to be the answer.
Yeah, I mean, I would say the same thing about sort of how we approach policy. We're thinking about, you know, a lot of the policy that we work on is sort of specific to how can we reduce risk. And I think we're often, you know, thinking about risk along multiple dimensions at once. So we're thinking about, you know, somebody's sort of people, for example, like I do a lot of work on policies that are known as red flag laws or extreme risk laws, and we're sort of thinking about, you know, how what are the sorts of behaviors that that people are saying that happens before incidents of violence, and they're really broad, but they are connected sort of across types of gun violence. So yeah, I don't know exactly how responsive that is, but I do think, you know, it's a very complex issue, and the connections between different forms of gun violence are multifactorial.
Okay. We have a question in the chat from Marilyn Webster that says, does watching all of the police stories on TV kind of normalize gun violence so we aren't shocked anymore? And is the effect of solving problems in a violent way versus restorative practice affecting gun violence?
Kelly, you got thoughts on that one?
I mean, I apologize if I don't like completely understand the question. You know, and the question about sort of TV stories, you know, I do think, and we feel it, like, so part of my job is we respond when there are shootings, like when there's a mass shooting, we respond, and it is amazing to see, you know, I do like press, I talk to the reporters about incidents of gun violence, and it's amazing to see, like, there will be incidents where dozens of people are shot, but if it doesn't have a high fatality count, like, it will barely make the news. So I do think, you know, the fact that we sort of watch these tragedies happen time and time again, I do think it numbs us, like, as a country, because we see it so often. I mean, it's incredibly difficult to keep up that level of shock that you sort of want to have when you see these tragedies, when you're watching them happen day after day. So, you know, I would say that I do agree, maybe not so much the coverage, but just the fact that gun violence is so prevalent makes it hard to be sort of alarmed every time it happens. On the question about restorative practices, I'm not sure. I'm not sure exactly what the question here is. I guess I would just say when we're thinking about incidents of violence, and particularly incidents of community violence, like gun homicides and community violence, a lot of the research suggests that an incident of violence will happen in a community, and then people in that community will purchase guns to protect themselves, or will start carrying guns to protect themselves. So, I would sort of maybe as an answer say, when we're thinking about acts of gun violence, like these are not, I don't believe that the vast majority of these are people that are going out that want to be violent. I think they are living in neighborhoods where trauma is high, and they are taking steps to protect themselves. And sometimes that ultimately will sort of perpetuate the cycle of violence. So I mean, that's what I would say is I think we have to sort of, not to say that there aren't any people that commit crime that are doing so because that's what they want to do, but I think we have to sort of step back and think about the fact that there are many incidents of violence that are happening because so many other circumstances have led a person to that point. I don't know if that wasn't responsive. You can let me know in the chat. I'll try and answer better.
Okay, we have a question from, is it Eliza Weidenbaum? Eliza or Eliza?
It's Eliza, thank you. Quickly, I wanted to share two ideas I've had. These are policy suggestions for the Giffords Center and any other anti-gun violence organization. One is in relation to mass shootings, and the other one is in relation to suicides and other even homicide situations that are just single person probably. The first one has to do with the gun shop owners who are identified often in news stories after mass shooting as having sold the gun. Just a small contribution to dealing with that might be a law that says if you are the gun store owner after a mass shooting, you will lose your right to have that store for a minimum of 3 years. And if that would perhaps be the incentive for those people, at least to do their own quick Google search on whomever they're, or Facebook search kind of thing on the person they're selling a gun to. And then on the more common deaths, I was thinking of having an anonymous Google form, essentially, so that any friend or relation to a person or somebody living in a situation where they know of the presence of guns and they have a fear that it could be used in a bad way. Not that guns can really be used in good ways, but if that person needs help helping to make that gun less accessible to their friend or relation, and if we could have the sheer people power organized through Giffords or any other group or coalition of groups, so that we could respond to anybody who anonymously fills out a form and says, hey, I'm aware of these guns in these positions, in these rooms in relation to me or my friends. How do I help reduce the likelihood that they will get used when nobody would have wanted it to happen?
Sorry, I was just going to say I appreciate both of those suggestions. I think on the second piece, one of the problems is that many states actually don't have good policies, and that's so these red flag laws that I was talking about. That's the premise of those policies is that it allows a process for law enforcement and family members to petition courts when they have noticed demonstrated risk among individuals to remove firearms. But many states, those are only laws in 19 states and Washington, D.C. And so there's actually not, in some cases, there's not good legal precedent to remove firearms when you notice behavior. And that's why those laws are something that we are interested in, because they sort of fill that gap. And I think the first suggestion, certainly gun sellers do have a responsibility, but I would also note that many gun sellers are required to run background checks. The majority of guns that they sell are probably not used in crime. And also there have been specific policies put in place at the federal and state level that shield gun manufacturers and gun sellers from liability when guns are used to cause harm. In different, it's different than the ways that the tobacco industry, we were able to regulate tobacco in large part by filing lawsuits against big tobacco companies and holding them accountable for the harm that their products cause, that's sort of different when it comes
Yeah.
to guns. But I certainly think it's an interesting idea and ways to sort of get around, to sort of think about how to tackle this issue in new creative ways. So I appreciate that.
That's really helpful feedback. Just to clarify, the second idea is not legalistic. It's to do something that laws can't do, that only people to people can do.
Yes, I think the concern that I would have just generally about that is without sort of a legal mechanism, we don't want to put people at risk. So we don't want to say, if I, notice a family member that I'm concerned about, if they have a firearm, that could actually be a very risky situation for me to try and intervene without some sort of legal backing.
Again, I didn't mean intervention, just suggestions.
Yeah, and there are
and support, like, because somebody
Yeah.
could feel really silent. They might not be even 18 years old yet and know something. And just getting
Yeah.
that knowledge to people who, I don't know. I'm kind of guessing here, I'll be honest, but
Yeah, no, and I think there are good resources. We have something on our website, and I know other resources are available. It's sort of like what to do if you notice warning signs of, what are places that you can call or what are steps you can take to, there's a lot in the suicide prevention space about sort of like where, you could store your guns safely within your own home. You could store them with a neighbor. You could, many police departments will hold guns for people in crisis.
right. So I hate to take up too much time here, but I've heard all of that before. I'm aware of that. And what I feel is there's a little gap we might be able to cross between that knowledge in general and then cases in particular specific, where people need a little social support and actually doing one of those or three of those things.
Mhm. Well, thank you.
Yeah.
Thank you for your suggestions. We're going to move on to the next question. And we have one from the chat. Should gun owners be required to buy insurance as car owners that would contribute to victim costs?
Kelly.
I mean, the gun insurance
I'm a physician.
it's a really, really thorny, a really complicated policy issue. I think, it's one of these sort of interesting novel policy ideas we haven't really seen. It's not something that jurisdictions to date have really adopted. It's not a policy that we've really seen put in practice. So it's hard to really know if this is something that would reduce violence or not. I think it's an interesting novel idea, but I do think at this point we don't really have any proof about whether that is a good way to spend our time for a number of legal and logistical reasons that are probably in fact above my own pay grade.
Okay, Jonathan Ross.
Hey, hi, everybody. There are a fair number of people who feel that we should really take a public health approach to gun violence. And if you think about gun violence almost like an infectious disease epidemic, because what happens in these neighborhoods is it could be gangs or it could be families, it could be other sorts of things. One incident happens and then the revenge motive kind of kicks in. And often it triggers several other shootings. So that's a piece of all of this. And we need to recognize that the highest risk neighborhoods for gun violence are also the risk neighborhoods for poor health. This is the social determinants that are part of all of this again. And those are clearly correlated. Actually, there's a famous French sociologist named Durkheim who wrote a book in 1897 called Suicide, where he looked at the social determinants of suicide, where people who had lost jobs, people who had, were living in poverty, people who had other types of chronic trauma. So we've known for more than 100 years that the social determinants can increase the risk of suicide. So I think that one of the things we should be thinking about, not only are these sort of downstream suggestions, for example, what do we do with gun shop owners? I would simply say, I think carrots are going to get you further than sticks with them. I mean, you could have both, but, reward them for doing the background checks, pay them for doing the background checks, would be something I would suggest, because we're seeing the tremendous costs that are involved in this. In terms of how to develop a gun safety culture in this country, I mean, I think there are a lot of legitimate, careful gun owners who could be part of that and would help with that. how do we develop the idea of not leaving guns unlocked in homes where kids can get at them? How do we make sure that we develop almost a culture of gun safety with training? And then we've got obvious things like putting the assault weapons ban back. We actually passed an assault weapons ban that didn't get re-upped. And now here we are again, more polarized than ever, banning assault weapons and large volume magazines. I mean, it's preposterous to say that the Second Amendment rights have anything to do with these sort of things. I mean, do we have a right to an F-25 to drop a bomb on our neighbor's house? I mean, the bottom line on it is that the weapons are so much different now, and our founding fathers had no idea that people could shoot 20 people in 20 seconds. I mean, that's just not even a thought. So to me, I think putting some of those things back in there, and then ultimately from a public health perspective, thinking about this as kind of an epidemic of sorts that we need to do interventions on. And some of the people that I've read about are working in these interventions. They're even calling them interrupters. They're people from the community, many of whom have experienced gun violence or been part of that network of gun violence, who are now working with the police, trying to develop, a core of people working in high-risk neighborhoods who are interrupters of this violence. So something happens, they're there to cool heads down, and our respected community members. So there are things that are going on that have actually evidence that they work. So it's not that this thing is hopeless, but it clearly needs investment. And so what we're doing is we're investing in medical care and mental health care and all these other things rather than investing people on the upfront end, including the social determinants such as poverty, lack of jobs, all those other things. If we invested in those areas, we're going to see gun violence come down too. At least that's what the public health literature shows. So I'm done with my little speech, but I think that there are things we can do.
Thanks, John. Any response to what he said from our presenters?
No, I just here in Toledo, I know that the Toledo is working on with the local Toledo Police Department and the government with local government with Save Our City, and that's what Dr. Ross is referring to for the violence interrupters, and they're working closely with our Trauma Recovery Center folks to help work on diffusing that situation. And I do think that is more to come on that.
Okay, we have a statement here in the chat that says, thanks for the presentation showing the magnitude of the shooting problem in the USA and Ohio. While statistics are impressive, healthcare horror stories are important to dramatize the emotional impact of shooting and recovery narratives. The personal stories of pain are needed to be evidence for the need for change in our gun policies. And, definitely that's how we hook a lot of people in. And what got me interested in this particular aspect of it, what about the survivors, was reading a story of the little boy who was it the Christmas parade or Easter parade, one of the two, where a shooter erupted in gun violence, and this little boy was shot, and he's now a paraplegic. His parents, I think, were both killed. Not only is it going to be the tremendous medical expense caring for him, but here's an 8-year-old who gets shot down, and his total future changes in a couple of seconds. And so what does he have? The other one story that hit me, it wasn't guns, but it was a teacher. She was on her way to school. She was 7 months pregnant at the time, and she got hit by a drunk driver, and she ended up being paraplegic. And in order to care for her and get the care she needed, her husband had to quit his job. They had to go on Medicaid. They couldn't take gifts from the family because that would prevent her from getting her Medicaid. They would have been over the limit, and that type of thing. They couldn't even accept groceries from family members and that stuff. So that kind of sentenced that family to a life of poverty, the husband, the wife, and the children. So those stories they tug at the heartstrings, and that's what gets people, interested. And that's why we were looking at this as far as what happens with the survivors. somebody else had their hand up and took it down. If you wanted to say something, do that. Richard Monk says, we have legislated the use of seatbelts in automobiles. Why can we not at least legislate mandatory gun locks and gun safes with criminal liability for failure to use in cases of gun violence?
That is a policy that some states, largely related to child access to firearms, but some states also require safe storage of firearms in broader sets of circumstances. But there are states that have policies that impose criminal liability if guns are not safely stored and children access firearms and cause harm. In fact, I don't know the exact number off the top of my head, but it's many states, I believe a majority of states, and there's differences in how strong those provisions are, but we see that those laws are things. But even sort of states where we don't make as much legislative progress, states like Florida have some version of those laws. So they are a policy priority for organizations like Giffords and others in the gun safety movement.
So it can be done if there is the political will among makers. Okay.
Yeah, I mean, I think that's like the big challenge. I think it's important. Like, this is a really complicated issue, and there's certainly, Gabby, for people that don't know Gabby's story, I mean, one of her things is she encourages us, everybody that works at our organization, and talks about, being bold. And so there is, I certainly don't want to discount that we need new ideas and sort of new policies, but a lot of the, we know, we have a lot of research. We know what works. Somebody mentioned the violence interrupters. Somebody mentioned large capacity magazine bans. I think we know a lot of the things that would be effective here. We just have not seen the kind of political will to actually implement those policies.
Yeah. Let's see, Kathy Caraway.
Hi, thank you for calling on me, Debbie, and thank you for fantastic presentations. There was a question about requiring gun owners to have insurance, and I think the gorilla in the room is the insurance industry, because we have laws in the U.S. that say you cannot insure intentional acts. So trying to get insurance companies to cover gun owners when the statistics that we have seen today are so certain there will be damage and harm for how many people who own guns. And of course, the people that are, if the legal gun owners are not the ones that are causing most of the violence, what's the point of insurance? But I think that if we go after the insurance companies, I mean, what are health insurance companies spending on those people who have it? What is Medicare and Medicaid spending on those people who do not have private health insurance on gun violence and its consequences?
The only thing I would just say, like, I do think there has been interesting proposals, not so much in the insurance space, and again, we haven't really seen these policies take off yet, but there have been interesting proposals in some states to, create an additional tax on the purchase of firearms to offset some of these medical care costs, to tax ammunition. We do have taxes on firearms already, and so there are some constitutionality concerns about, we don't want to overtax these products, but and those taxes, a lot of them go to conservation efforts. But I do think that is a sort of interesting way of, it's a little bit different than the insurance, but it's a way to potentially think about offsetting, having people that are choosing to own guns and be gun owners, having them sort of help offset the costs a little bit of the harm that guns in some cases create.
We have a comment from Dina Magulius. She says that we have a violence interrupter group in Cleveland, Stopping the Pain, that just received funding. There's also a group called God Before Guns that is run by Reverend Chris Eggert. And her big push was trying to get the mandatory gun safes in homes. And she was met with deaf ears by the Ohio legislature, but that's not a surprise knowing our legislature. Mary Ann says the CDC puts out a weekly morbidity and mortality report. It does not appear that guns are a part of it. That would be impactful. The CDC has a separate page for that. Is there a reason why the guns are not a part of that? Does anyone know?
So actually, I don't know specifically. The MMWRs, the morbidity and mortality review reports, are an ongoing publication, and there have been some that are about firearms. I don't know how recently but I would say for a long time, the CDC was very, the CDC lacked funding to study firearms research. There was an amendment, a federal amendment passed in 1996 that stipulated that federal funding couldn't be used to advocate for gun control. Many people in government agencies like the CDC interpreted this to mean that they couldn't study gun violence. So a lot of, I know John talked a little bit about the lack of research on this. A lot of that is because of federal policy choices not to invest in this research. But in recent years, the CDC, starting in 2018 or fiscal year 2020, and every subsequent fiscal year since, the CDC has received funding to do firearms violence research and have done so. So I don't know, it may not be in the MMWR reports, but there's certainly other resources that the CDC is putting out on this issue.
Mhm. Yeah, Dina points out that their family practice medicine residency at one point passed out gun locks to patients, which would be great. But then weren't doctors muzzled as far as their ability to talk about guns with patients?
Quite honestly, from my perspective, I feel a responsibility to talk to patients about, most of both the health concerns that they have, but also the social factors that they may be experiencing. And I think if that's a program that was started, I think, she also makes a comment that somebody says what happened, and like everything else, there is turnover, there's residents, different programs get funded. There's no money for, buying those gun locks to hand out to patients. There are other programs too, though, that look at handing out. I think our program actually wrote a grant recently to get lock boxes, and for firearm box that's locked up, that we are looking at handing out to patients that are at high risk, or they have a weapon at home and they just don't know how to handle it, or a place to lock it up. And so we're looking at, and that not just a gun lock, but an actual box that the weapon can be put in. Obviously, that doesn't help some of the rifle stuff, but at least it's a start. And I think that is part of the challenge. Is if it isn't going to be one person, it isn't going to be one doctor, one family medicine residency. It's really going to take a multitude of people to take a look at the issue and try to tackle it.
Yep. Thank you. What about the thoughts on House Bill in Ohio, House Bill 316, on the allowing temporary seizure of weapons if an individual appears in danger to themselves or others? Is that what you would consider the red flag laws?
Yeah, I haven't read House Bill 316, so I can't say specifically. It sounds like it's one of these red flag law bills, which I think those show a lot of promise. I've done research on those in Florida and in other states, and I think they provide a really important legal mechanism to temporarily remove firearms through the courts when people have demonstrated a risk that they may harm themselves or others with a firearm. And I would note that it's a sort of, legally speaking, these are civil court orders and not orders in the criminal court. So I think it's also, a way to sort of reduce some of the criminal legal system burdens of gun violence by diverting these orders into the civil court system. So yeah, I'm assuming that's what that bill is, and there are different ways in which these bills are written, and so I wouldn't want to speak specifically to like what exactly that bill does, but it sounds like it's that kind of process, and those laws in other states have been very effective.
Okay, another question came in. Is there anything we can do in Ohio, considering our legislature has passed open carry laws and is dominated by gun rights groups?
Yeah, I think in terms of like legislation that's been passed in Ohio, certainly we've seen not just the permitless carry legislation, but also the state has expanded sort of what we call stand your ground laws, which permit people to use force more broadly in public, both of which we believe are going to lead to more violence in the state. So, I think at this point, maybe given the makeup of the legislature, and again, I'm not super familiar with Ohio, like the politics of Ohio, but I do think that there is opportunity and appetite, even among some people that don't want to vote for gun safety bills to vote for, to support these community violence interventions, to support, hospital-based programs like those that John talked about. So I think those would be the areas that I would sort of suggest would be important for advocacy at the moment.
Thank you. Dee Chavez?
I just wondered, a few years ago, and it stopped because of the pandemic, but we were working on a ballot measure to get universal background checks in Ohio. And then it stopped because of the pandemic. We couldn't go door to door anymore. Did that, and I feel like I've heard something about that being enacted in on the national level, or is it just in some states that have it?
Yeah, so background checks, just really quickly for people that don't know, any federally licensed gun store, so any gun store that you're like going into a physical brick and mortar gun store has to get a license from the federal government. So that could be like your sort of mom and pop gun store, or like a Walmart or a Dick's, and they are required by federal law and have been since 1993 to run a background check on every gun sale. The problem is there's a private sales loophole, so that if you sell a gun between two individuals, that sale, you wouldn't have to undergo a background check. So the idea being that if you are a person who might have a dangerous history or wouldn't pass the background check, you might, we talk about it like the airport security line. If there's one line where they're going to do a lot of screening and one line where they're not, and you're trying to smuggle something onto the airplane you shouldn't have, you're probably going to pick the line that doesn't have a lot of screening. Many states have closed that loophole by requiring background checks on private sales. So that's what we're talking about when we say universal background checks. Federal bills have been introduced, but have not been debated in the Senate at this point.
And what about the gun show loophole? That's the other thing I forgot.
Right, so that's part of it. So the private sales loophole is not just individual to individual, but also at guns shows. Individuals can sell guns there, and they are also exempt. I mean, again, if a brick and mortar like mom and pop store that sells volumes of guns is at a gun store, at a gun show, they're going to have to run background checks. But if you're a private seller going to a gun show, you don't have to. And it also applies to online sales. We see that, people are meeting people online that they don't know, and then they're selling their guns without a background check.
Okay, thanks.
Another idea was for the US, the government, to go to gun shows and buy them all up.
Not the government, people on this
us.
call, people who are on this side of things. Just do our own buy up as opposed to buy back.
Yeah, I think I have other things I need to spend my money on right now, like heat for the house, but
No, but like organizations like Giffords or others that actually have money, throw a few thousand at that. I don't know.
Yeah. Rita, go ahead.
Yes, thank you. I was just going to say that I think the costs are a lot more that's reflected there. I can just give a couple of personal incidents. So as an RN and a nurse practitioner working at the VA, which by the way, we do give out, I always asked all my patients if they had a gun and if they had it locked, and we had gun locks to give to them. But when I was working in the caregivers program and covered about 15 or 16 counties, I would go out by myself to veterans' homes that were in that program. Often veterans will live in places very remote. But one day I was working and I got a call from the VA police, and they are like, "Where are you?" So I told them, and they was telling me of one of my patients that was in Newark, was outside with a gun. Police had surrounded her. She was threatening to kill me. Now, I wasn't there, but that was very traumatic. She had went off her psych med. She had to be admitted to the hospital. I changed what I was doing after that. I didn't want to go out to the homes anymore. I had to go to court to get a restraining order against her. I found out, you could just Google my name and find out where I lived. And I was scared for a long time after I would come home. Like, is anybody following me? Is she watching me? I had to go for counseling after that. I had to go on medications. Anytime I go to Newark now, it's it doesn't, I'm still feel traumatized by that. And that's just one incident early on in my nursing career when I worked in ICU taking care of gunshot wounds. A lot of times that was traumatizing. So I guess what I'm saying, I think the costs are a lot more than what is reflected there. The mental health costs and, you know, the costs that I loved working in the caregivers program and going out, but I wasn't willing to do it after. Actually, I went into telehealth after that. I was so upset.
Yeah, I think that's one of the aspects that often gets overlooked. You know, and Kelly made point of it to make mention what we don't really realize is that these the gun violence or these incidents really do affect the doctors, the nurses, the first responders, the EMS, EMTs, the police, and we you know, we're faced with it kind of every day. As a trauma surgeon, I walk in one room at 2:30 in the morning, pronounce somebody dead, walk right into the next room and have to see somebody. And you know, at our hospital, our trauma recovery center and myself we're working very diligently to start a program we have for a couple of years, but it's basically providing brief emotional support. Then we have debriefings and some other avenues for us to deal with some of those things. And it really is a real problem. I mean, it affects not just the patients' families, but often nursing, doctors, the you know, people, housekeeping staff that have to clean up all the blood. I mean, it's much more broad than just you know, the person who got shot, or it's a tremendous issue. And I really I'm really sorry that happened to you, because it really did change your career.
It would. We do have a comment from Angela who says foster parents are required to have firearms and bullets locked separately. So if we can do it for foster parents, then maybe we can expand that a little bit. And there was another suggestion that we need to pivot to lessen some of the negative impact, pivot to promoting secure storage of firearms and campaigns that can save lives. And to go out to council, school boards for resolutions to get this message to residents and parents. You know, one of the other things too is it was pointed out to me that Canada has as many guns per capita as we do, but one of the things that they have is a sense of community, and we're all in this together. And you see that through some of their you know, their public programs like public health and that type of thing and stuff. We're missing some of that, you know, and while we mourn those who lose their lives to gun violence, we also have to think about those that survive, and they aren't always getting the attention and what they need, you know. And it's not just the survivors at the shooting, it's the people that have to care for them. They're survivors in that too. Yeah, but I don't see any other hands up, and everybody's saying thank you, and people are signing out. So I think we can say that we want to thank Kelly and John Leskovan very much for their presentations and their expertise in this. It's a difficult question to deal with, but other countries have managed to do that, and I think we can too, if we all join together and maybe create that sense of community.